Oh, all right.
We're ready?
All right, it's Wednesday, July 8th, 10 o'clock, and we're ready for the Shawnee County Department of Corrections budget hearing.
All right. Well, thank you very much, Brian Cole, Shawnee County Department of Corrections. I first want to say thank you for giving us the opportunity to present what I believe is a very fair and very fiscally responsible budget for 2021. I also want to say thank you to Betty Greiner and the help of her office in helping us answer any questions and helping us understand the process as always and working close with them. I also want to say thank you to two people that are with me that'll be able to answer questions and provide more information. One of them is Major Eve Kendall, who put together the Department of Corrections detention budget with the help of other people, but Eve put a very responsible budget, kept in contact with the audit finance staff and administrative services regarding any questions or corrections needed to be made. And Major Tim Phelps, who put together and worked with the Kansas Department of Corrections with the community corrections budget, which we'll talk about later. But both of these officers and staff members or deputy directors worked very hard and diligently with that. To give a quick overview about the Shawnee County Department of Corrections, we're a unique situation that where we're one of very few that are under the direction of a Shawnee County sheriff. Many years ago, back in the late 70s, it was decided that corrections professionals were to run the Department of Corrections and not law enforcement. They felt that law enforcement and corrections had two vitally different philosophies and visions, and I would agree with that philosophy. And so ever since then, it would have been 1980 is when the Department of Corrections became its own department, and the directors appointed with the Board of County Commissioners. During that time, we've set a department vision of achieving excellence through integrity, dedication, and teamwork. That is our ultimate goal, to come to work each day to do the best job we can, and the three guiding principles, one of them being integrity, to having character, doing the right thing whether anybody's looking or not. Whether you're on duty or off duty, you represent Shawnee County, the Shawnee County Department of Corrections. We have to have people that we trust. Dedication, being to work every day. We don't get to close the shop. You can see right now we're in the midst of the COVID pandemic, or when we have an emergency, tornadoes, ice, whatever, we have to show up to work. We do not get to put the sign up that says nobody here today. So we have to have staff here. We're 24 hours a day, 7 days a week, so we have to have dedicated employees that are here. Our staff at the department understand that they often have to give up some of their personal things. They have had to miss personal outings or parties or birthdays with their families, knowing the mission of they have to work shift work. And I appreciate the dedication our staff have to Shawnee County. And then teamwork, working together. Not everybody, we understand, gets along. We have a very diverse group of individuals that work at Shawnee County, but for us, you have to come together and work together as a team. We would not be where we're at today if we didn't work together. We have to work together with a team. We have to work with our partners in the county. We have to work with our community law enforcement, the judge. So we are the biggest agency in Shawnee County, and thus we believe we have the responsibility to ensure that we maintain positive working relationships. Our vision statement of Shawnee County Department of Corrections shall operate as a model correction facility while providing the highest level of safety and security to the inmates and community. The two concepts we put in there is one of them being a model correction facility. We follow and exceed national standards. We're accredited on our juvenile detention center. We do follow all of the necessary requirements that we know of right now for ACA on the adult side. We are accredited with the National Commission on Correctional Health Care when it comes to our mental health and our medical health. So we believe that being a model correction facility is the path that we need to take. We have to be very professional. We want to have a benchmark that we follow and exceed national standards that helps us understand and improve, keeps us out of trouble, works during liability issues, and things like that. The other one is providing safety and security. That is our highest goal. Providing safety and security, whether it's through our hiring, our training, how we hold staff accountable, how we write our policies. Everything stems around the highest level of safety and security for the staff and the community and the inmates. And along that, we have set personal goals of an agency, 7 goals. Obviously, Highest goal is safety and security, maintaining the rights of our inmates and juvenile offenders, ensuring that we meet and exceed correctional standards, that we have a professional environment for our staff to grow in, a professional environment that they can promote, learn, and do other things. We want to make sure that our staff or our inmates have the opportunity to learn and reintegrate back into the community. We want to make sure that we have a facility that is safe, sanitary, and where other agencies talk about outbreaks of things like scabies and MRSA or whatever, we have minimum amount of cases when it comes to that. And the last goal is to make sure that we have a very good collaborative relationship with all of our partners in the community. We review these goals and our mission every year. We review our policies every year to ensure that we're doing the right thing. Not only does it mean that we're looking at the standards, we're looking at the applicable court cases. Where we're at is the things we do are dictated by the courts. A lot of things that we may disagree with on how the courts have handled it, but we're mandated to follow those things that happen. And we have a very good legal team under Tim Phelps, and we also work with Washburn University that helps us with their internships to help us put together a library when it comes to religious things and things like that. For department challenges, we're like others. Our biggest challenge right now is hiring retention. We started out the last quarter about 40 vacancies. We are today at about 51 vacancies. We've had staff that have quit because of the COVID. They're concerned about the environment. We've had people that have not made it off probation, just did not meet the standards and expectations. But we're finding that some are coming here and not showing up to work, and that we've had to get rid of. That becomes a very big challenge for us, because unlike jails of our size, you have to look at the physical plant. We have 30 posts on first shift, second shift, and about 20 posts on third shift. Well, when you're down 50 and you take 20, 20, and 10, we're needing overtime every day, some days as much as 15 people. We're managing. We have supervisors that are picking up the slack. Our staff in management have put on uniforms and have gone and worked the modules and the hallways at the same time, working outside our normal hours of doing this. But we're working close with, again, administrative services and human resource to come up with everything we can for far as recruitment, newspapers, internet, career fairs, specialized career fairs, radio, global circles, you name it. We are doing everything we can to reach people. We do have applicants that are coming in. A great majority of applicants will sign up for an interview, and then we're finding they don't show up. And we believe that has to do with some people are just doing it for, I'm on employment, I just have to show that I'm going out and looking, which has been very disappointing because we do put a lot of people in there. One thing I will say is that in working with administrative services prior to the COVID pandemic, we were working very hard on a response to the salaries and looking at where Shawnee County fit regarding our competitors, Kansas Department of Corrections, law enforcement, and things like that. And we found out that we still today are significantly $2 and $3 behind other agencies. And we were working very closely. Betty was working with us and Angela Lewis on finding alternatives, funding sources and a plan with the union and things like that. And then when the COVID response happened, that kind of put a lot of things on halt with our planning and our activities, because the COVID response became the priority. And as much as I hated to see that, we understood that. But we've got a lot of work to do when it comes to our salaries. We are losing through our exit interviews. We're finding the 3 top areas. Number 1, mandatory overtime. People are tired of being ordered. We have people that are going to make as much or more money on overtime than they are at their regular salary. Stress of the environment. The environment in corrections, the PTSD rate and divorce and suicide in corrections is reaching a national high that's almost as high or higher than military, according to the studies with the National Institute of Corrections. And then last, salaries. When people are able to go to the Kansas Department of Corrections for $2 or $3 more an hour to do the same job, that's attractive in these days. So we're doing our very best in trying to meet that challenge. The other thing is overtime, and I think that we've spent, I believe, about $2.1 million in overtime. We are below that this year right now because of, we did have a reduced population because of the COVID response. Because of the courts closing, we were able to repurpose staff for the purpose of COVID to clean, like our transport, our training staff, because of groups and things like that, put them back into operations. And then again, our supervisors and management stepped in to reduce overtime. So we do see, we have seen a reduction of overtime, but I can tell you as the courts have opened, things have opened more and things like that, our overtime has gone up. I don't believe we're on path. We're probably right on path to be about the same because of the salary increases of there. But we do see that the hours are lower, the number of hours, what we do, but we're spending the same amount of money because of the salary increases that just have been implemented. So we're doing our best when it comes to overtime. And then I would believe that healthcare becomes our, mental health becomes our third biggest challenge, or special needs inmates. This is a challenge. We don't get to dictate who comes to jail. We have to accept, by Kansas statute, we have to accept every inmate that comes to us. We do have a good working relationship with the law enforcement in the hospitals, that somebody comes in, if they're so incapacitated or intoxicated or unconscious, we can send them to the hospital. But as a matter of fact, they don't have to take them to the hospital. We have to accept. Healthcare costs are an unpredictable cost. And to give you an idea, that it was about 3 months ago, I believe, we had one inmate that spent a week and a half at KU Med Center, and that bill was about $300,000. And that's one. Our total budget is $380 for that. So off-site medical is a huge impact. And again, we have no idea. We serve those that have cancer, HIV, our medications, mental health, and regular health care. It's extremely high. We have done a very good job working with Courthouse on keeping our medication costs down, but we tend to see the off-site medical costs continue to be high. For us, when you look at our budget, and I also want to say mental health is huge in that, because that is a huge challenge for us as well, because we're not mental health experts. That we do have a lot of training that we're doing, and we're doing our best, but when it comes to the cost to manage it, it's about 3 times more. And it's no secret, and I've said this before, that Shawnee County Department of Corrections is the biggest mental health facility in Shawnee County. With about 25% of our inmates are we deem as serious and persistently mentally ill that are on a lot of medication. Not only do we have our challenges, but we've had our successes, recognitions. All of our audits, we've exceeded 100% in all of our audits, and some of them with 0 deficiencies. The juvenile detention center is in the top 1% of juvenile detention centers in the United States. We're proud of that. We continue to work with our juvenile detention alternative initiatives of finding alternatives to incarceration, working with our community. We have fully accredited on the juvenile and through our medical and mental health. We are seeking PREA, which is prison rape elimination, which is an unfunded mandate by the federal government. We're continuously working to get fully compliant with PREA. Our programs on both the adult and juvenile are very good. With the COVID, we had to reduce some of those with our volunteers, but we're hoping in the near future we can open that back up. Our technology that we continue to work on is very good, that we work with law enforcement. So we're not without our successes. I believe that we do run a very good department. The staff there work with me, not for me. The staff there are the reason for our success, and I'm very proud to be the director. To get into our budget, do you have any questions at this time?
I had a couple of questions on recruitment. I know at one time we had a conversation about working with Washburn Tech, and I think Gary Baines is in charge of that. Has there been any more conversation about
working with Washburn on? One of them is with Washburn University, is that we're working on a career fair. Because of the COVID stuff, that got knocked out. Right. And so that put a big damper on a lot of it, that they do specialized things. But we're working on a full academy with Washburn University, and then looking through their criminal justice department on trying to recruit. So that effort is still going there. With Dr. Gary Baines, we are working with other law enforcement and they're doing another similar model at other VOTECs or technical colleges on creating a law enforcement or public safety certification. And that I'm working with Gary and Melanie Woosley, Dr. Melanie Woosley, on putting up a curriculum, which is much closer to like a community college curriculum for that. So we are still in the middle of that and working that right now. The COVID has put a stop to us putting all of that. We have not put all of the curriculum together, but we are working on that curriculum as we still are. But throughout the whole pandemic, at the very beginning, we did over-the-phone interviews, which continued on. As we got through about 2 months, working with some of my colleagues in other jails, Department of Corrections, hiring and retention was still one of their biggest deals. We do have on-site and are able to meet all social distancing stuff. So we had one person start 2 weeks ago. We had 3 start Monday, and we have several in the hiring process and things like that. So recruitment, if there's an avenue out there, we've done it. And we will continue to do it. And that even means our supervisors are going out, handing out cards, doing interviews. We do walk-up interviews, and that has been successful. If somebody doesn't show up to an interview, we call them back. But to answer your question, Commissioner, yes, we are still working with Washburn as much as we can through the COVID pandemic to get as much recruitment efforts as we can.
Is there any kind of a certification program for corrections? Now, you said you're working with Washburn Criminal Justice, but I mean, it seems like anecdotally what I've heard before is that sometimes as criminal justice majors use corrections as a stepping stone into something different.
Correct.
And so the retention's not that high.
That is true. You will see incorrect, there is, by statute, and Tim probably can answer this better than I can, by statute, law enforcement, they have to be certified law enforcement officers, meaning going to the Kansas Law Enforcement Training Center, and they by statute are certified. Corrections, there is no specific certification for corrections. We are working on that with the Kansas Association of Sheriffs, and I'm working on that with Washburn to try to come up and try to meet with our governmental agencies or representative legislature on trying to figure out how we can bring credentials to the field of corrections as having a public safety or certification with that. But a lot of people do. They come here to corrections to get their feet wet, to go into law enforcement, probation, parole, because they see probation and parole and corrections, they see that down the road as more of more paperwork, a more consistent non-shift work, a job that they see much more benefits of flexibility, things like law enforcement. You just have much better pay and benefits when you can dollars more an hour, and the KPNF alone for the retirement will get people to go there. But I do know that the legislature are working on with Kansas that jails and correctional agencies, if you strictly are in the field of corrections, even if you're in law enforcement, that counties can opt to go into the KPNF. I haven't seen where that's at yet, but to answer your question, I believe that's correct, isn't it, Tim? That there are no certifications as far as a certified corrections officer.
It seems like something that maybe the community colleges would be a good place to do that, so that people don't feel like they need to get that 4-year degree.
And that's what I'm hoping at the
and
vote.
Associates is enough to get that bump in pay or whatever.
Correct.
When they get there.
And one of the things that we're trying to do is at the vote with Dr. Baines is getting that population under the age of 21 to get them started, to make this a 1 or 2 year program. The time they're done, that they'll be eligible to come in. Also, I am looking and seriously considering of lowering the age, starting age. Not, some jails have gone to 19 and 18. I can't do that. But I do believe there's value in doing it at 20. And if we can get college students to come in and they're doing their education at the age of 20 and are working, one of the models out there is that they're paying them less or putting them as more of a cadet in corrections while they go to school. The agency is helping them with tuition reimbursement, and then when they're done, then they come on as a full-fledged officer, then they go through the union and stuff like that. Those are the things that we're working on with Dr. Baines.
It's almost like an internship
Yes.
type of program. I
Yeah,
know
prior to their, and then they would get the
TPD
certificate.
did something like that with Washburn, where they would pay them $15 an hour or something for their junior and senior year of college
Correct.
in Washburn. So, yeah, I can see
Yeah,
that working.
and so that's what we're doing with that. So there's a lot of things in the works because corrections takes a backseat to law enforcement, and it always has. And but I do believe that they're both well important and difficult jobs. To get into the meat of our budget, again, I believe this is a very responsible budget. When you're looking at the budget overview, our increase for Shawnee County Department of Correction detention. As directed, you will see that there are no salaries as directed that were increases put in for anyone for all of 2021 through the very beginning or at the end. So with that, we have about a 0.48% increase to our budget. Now, with that, we have seen a zero increase because we've redone the contract, and we're doing the contract with Aramark right now. At the direction of the commission and working closely with Betty Greiner, Administrative Services, we feel it's appropriate to get our chemical contract in our Aramark contract because that's where we're going. We see that that's the best there. That contract right now is at the county counselor's office. We expect that contract to be a 2.5 increase, but we have not got that back yet. But since we did not have that at the time, it was a zero. So our contract with food services is a zero increase at this point. For healthcare, it can again continues to be a major concern. We are seeing a 3.3% increase in medical, and that has to do with offsite medical and pharmacy. But again, if you look at the total budget, even with these increases and things like that, you will see that we're at less than 1% increase for the Department of Corrections. I feel that that's in the past is much lower than what we've seen in the past. We understand that we not only do we have a big responsibility, but we also are not the only department in town that has desires and has requests as well. So again, with having a less than a 1% increase, we do believe that this is a responsible budget. Would you like me to go into?
Go ahead.
On the salary, in the union salaries, is that because of turnover?
Yes. Yeah. I mean, we have that many vacancies.
Because
yes.
you're bringing someone
We've
in
had,
lower
and
staff.
we're going to also, I'm looking at maybe, and you bring up a very good point, Betty, because we have to look at turnover that way. I will have somebody that's going to retire in Havas. We plan to stay, but you do see retire, and so we have to look at that as well. But yes, that's a very good question,
I
Betty.
have one other question. Just to look at on the medical, the healthcare, that area, our Horizon contract, as I think you mentioned, requires increases each year. Do you have the dollar amount? I believe it's probably just the difference that's on this contractual services
Correct.
line for that, which looks like, for Commissioner's sake, it's about $113,000.
Yes, that would be
Okay.
correct.
Generally, Commissioners, what we do, because that is a obligation, a contractual obligation, what we look at is, as we start working on the budget, and we usually start with a flat budget, we generally start by adding that to their flat budget, because that is a contractual obligation. That is, Corizon handles all of the medical, we contract with them to handle the medical, and our contract with them requires an increase. I think it's connected to the CPI.
2%, annually.
Yeah.
For the first 4 years guaranteed. After that, it's optional for 2 years.
And
So,
also-
just so you're aware that that will be a contractual increase.
It is a contractual, and also statutorily required that we provide health care.
Yeah.
Yeah.
What year are we into that contract?
Next year will be year 4, so it'll be the last of the guaranteed years. And then we'll have to look at whether we're going to renew them for the next 2
2 years.
1 year at a time, or whether we're going to reissue the other.
Okay.
Should I go into capital outlays? Okay.
Yes.
In priority, with our capital outlays, DOC roofing, that Eve Kendall has some photos that she would give to you all, that this is the original roofing on both the adult detention center, the original facility, which is about 30 years old, the Annex, and the juvenile detention center,
Go ahead.
which are several years
He's gonna
old.
be here later.
This would include the tear-off and replacement of a dural synthetic rubber membrane. The JDC is approximately 20,000 square feet, and the adult detention center is approximately 5,800 square feet. The budgetary bid to replace this would be about $1.1 million. This is something that we put in capital outlays, but there were other needs of the department and other needs of the county that were prioritized, and we understood that. We will say that we are getting to the point to where we are seeing, with this being the original roof, that we are seeing continuous maintenance, and it's something that we do feel very important that it has to be addressed. The next thing would be the Department of Corrections Annex Security System upgrade. This is an upgrade of aged cameras and a system so it can connect to the larger system. When we built and opened up the Annex, I believe was 2005, we put in the Annex security system, but what they called value engineered, because to keep the cost down, we did not have the connectivity of putting the system to where somebody on the adult or control centers could monitor what was happening at the Annex. They are all separate. When we looked at this situation and working on our COOP plans, and we've had emergencies where we need the ability, if we have an emergency at the Annex or at the juvenile detention center, or the adult detention center, to be able to set up a system to where we can monitor those away from the facilities. And we can't do that right now. And so that's something that we feel that is a very high security need of being able to have that connectivity to our control centers. The cost of that is about $105,000. What we are recommending or asking is to look at this in 2 phases. In 2021, about a $30,000 phase of looking at a study, looking at the drawings, the plans, and Eve can elaborate on that more with any more specific questions. And then 2022 would be 75, and I think that would be more of hardware and equipment. But we do know that this equipment is it's expensive. But this was something we did put in the initial budget when it came up there, but it was something that was taken out at the time due to funds.
Right.
Yes,
Can
ma'am.
I comment on that one? When we redid the security cameras for the courthouse, one of the things that we looked at in that was a system that could be expanded. We would like to eventually get to the point where all of the county security cameras were all connected, and the sheriff would have the access to look at all of them. So I think if this is something we get to the point where we want to look at having as a capital project, I would like us to look at expanding the courthouse security system so that the deputies here would have access to it as well as others. I know you would want it to be part of your system, but also to make sure that it is compatible with the system we have here, that, so we continue on that goal of eventually having all of the security accessible.
I can tell you, commissioners, that when I was helping the group that was selecting the county camera system, one of the driving considerations was that it would have the capacity to integrate. It's the same hardware, the same software, so that if we ever needed to have it where we could actually control and see everything for one side or the other, we could just interface them through a network. So that way, it's good to have it to where we have that flexibility.
The last two things are things that have come up that have been discussed over many years. One of them is the Department of Corrections, the old kitchen renovation. This was talked with and discussed with Betty and several others with the previous commissioners of renovating the old kitchen area and renovating that into mental health area for staff and inmates, that we have little to no adequate space to really functionally handle and deal with our those who deal with mental illness. We're looking at having an area that they can counsel, they can treat, they can meet, and deal with those inmates that are suffering with mental illness. At that time, we were looking at a total project of about $1.3 million. And that was something that we were discussing, looking at trying to do in phases with the next issue. But we do see that the management of mental health, that is one of our biggest challenges. And we have this space, and would be utilized next to a module to where those with mental illness can be right there, so we can professionally, confidentially, and I guess professionally handle those and meet and exceed those expectations. The last thing was the DOC Sallyport booking and transport area. The facility was built and opened in 1988. It was built for about 220 inmates for about, basically about, much like the kitchen, 600 meals a day, not very many bookends. We built a new kitchen because we were about 3 times that size for the jail. Right now, we're running into that same problem. Our booking area is the original booking area. Now it's not uncommon to have 30 to 40 people down in our booking area. Overrun. It stays in good shape as far as cleanliness. It's functional, but we're have to retrofit. It's just not a very safe and secure and practical area. The Sallyport is becoming more and more congested. We recently did something to one of the doors so we can even have a bus that can even get into it. Again, this is the original facility and the footprint to the facility that was built for about 200 inmates. We have a rated capacity of 705 inmates, bed space about 775, juvenile 75. So when we get 3 or 4 police officers or law enforcement in the look at this facility, when we started working, the commissioners approved us to go out for an RFQ to select an architect firm, and make sure I say this right, Tim, an architect firm to look at and design and this stuff. So we did pay, and that was like $40,000. I think that was used off of COP money that we had in the past. So we were able to look at that. So that was about 3 years ago?
It was 2.5, 3 years.
2.5, 3 years.
Closer to
So the commissioners approved us to go out there. There were other priorities of the commission and other priorities in the county, and we understand that. But we're getting to the point, and one of the things that the previous commission have asked, and even at occasion, I get asked about the future of the facility as physical plant. Shawnee County has a history. We opened up in '88. In 98, we added on 288 more beds, and we added on a 75-bed facility, at least 200 beds. Right now, we are seeing that our capacity is being able to stabilize. I'm not suggesting we need to put on 200 more beds in the facility. Do I expect in the next 10 years that you might have to from 2008? Yeah, we might have to. Areas of renovation that we see as an agency and having our colleagues see is the mental health area. Our bookend is outdated and becoming non-functional. Our transport area for the safety and security of our transport. 2 officers were killed in Wyandotte County with our transport and then our Sallyport. But as I put them in priority, we do believe as a team that the DOC roofing would be our highest priority, the Annex upgrade, and then the old kitchen and the Sallyport when I look at those capital outlays. I always end my presentations not only to stand for any questions, but the benefits of the taxpayers to helping us run a fiscally responsible department. Yes, ma'am.
I'm sorry, before you get into your ending there, can I ask a question
Sure.
on the transport? With the courts doing so much more electronically, how do you think that will change your transport needs?
Well, I will say, it will change it. I don't know that we'll be over here as much. I would have to see, right now, they're doing a lot more preliminary things at the jail, but your jury trials, your prelims and things like that, we're doing mediation, so we're having that. We're still seeing right now, we've seen an increase of those coming. I think we're very far away of having any jury trials at the jail, preliminary hearings at the jail and things like that. So I do believe that we probably would see some decrease, obviously, in here, but
Betty, I don't think we're gonna see a decrease. I think this is a momentary drop,
Okay.
but this is just momentary. And the reason for that, defendants have a constitutional right to be
Mhm.
present for all hearings.
Mhm.
They have the right to be able to see their accuser. They have a right to be able to consult with their attorney. And so, for status hearings, we might be able to do by video, but when it actually comes down to the preliminary hearings, motion hearings, trials, even, I mean, we can do a plea by video, but even the pleas by video, there's a question, did you fully understand what you were doing? And we don't want people coming back after the fact and trying to set aside their plea because they didn't like the sentence they got. Sentencings have to be done in person. And so I think what we're seeing is a momentary drop, but there's so much that has to be done in person.
And Commissioner, you bring up a good point, because when they set up all the Zoom meetings and stuff like that, the Judge Anderson made it very clear that the inmate has to want to waive the right to not be in person. We've had a few that have waived, that we've had more that said, we'll go ahead and do it at the jail, but we've had our few that said, no, I want to go to the court. And so we've had to do that. But I think we'll see some reduction, because we are going to see some stuff happen.
Director?
Go ahead.
Can I just offer one thing also on that consideration, and that is that.
Sorry, Tim,
Oh, yeah, right.
since we're streaming.
On the issue of trying to modify the Sally Port, it does include the concern about volume of transports. But the larger concern was about the mixing of the incoming and the outgoing. The design that we're looking at would radically reduce the risk of there being incoming inmates at the same time that there are outgoing inmates headed to court and to doctor's appointments and those kinds of things, because that's how contraband isn't properly controlled, or one way that it's not properly controlled.
I apologize for being late, but which of the three models are we still looking at? Are we looking at redoing the Sally Port through the middle, reconfiguring the Sally Port to be in front, or reconfiguring the Sally Port to be in back?
We didn't go in that much detail, but the thing that we're currently looking at has it in the front,
Okay.
and has the current Sally Port being modified to be our booking operation and some classification stuff.
You would drive right off of,
Right.
you would come right off of 8th Street, and you would go right into the Sally.
Yeah, because we've been talking about this
Correct.
for 2 years. I mean,
2.5.
I mean,
Two
the
and a
only-
half to 3 years.
Yeah, yeah. The only barrier is cost. I mean,
Yeah.
it's just money.
Yes.
Yeah.
It's expensive. Jails are not tough to build, but when you put, are not easy or not cheap to build because of the cost. Before I go into the benefits of the taxpayers, do you have any, or would you like me to talk about the benefits of the taxpayers that we feel, and then you can ask questions? I'm more happy to do whatever.
It's fine with me.
Well, I've always been told by those that have been mentors to me, it takes a lot of money to run a jail, it takes a lot more to run a bad jail. I believe that we have an operation that is second to none. I'd put our operation up against anyone. We have tremendous staff that are loyal and dedicated. We meet and exceed national standards. We are just one accreditation away from being a Triple Crown accreditation as far as all of our detention, PREA, and our National Commission on Correctional Health Care. But what we believe is the way we're doing business, our medical costs and our workers' comp stuff. Better accountability. We hold our staff accountable. Increase releases from jail. We are constantly working to reduce the cost to the taxpayers. And we've worked with our courts regarding sufficient bonding now, about $100 a day to hold an inmate. If you talk about an inmate that has with cancer or whatever, you're looking at $300 or $400 a day, and with mental illness. And I do believe Betty and them, we are working on something with Maximus on, I thought we were regarding looking at the new per diem rate. And it's about $300 or about $249 for a juvenile, but we get reimbursed, I think, $150 or something like that. Reducing liability costs to the department. When you are an accredited facility, it doesn't prevent you from being sued, but what it does is provides a backbone that, because not only do we have policy, we have the ability to show that we practice what we preach, and outside entities can come in and support us. And the other thing is that if we can stay up on a professional, safe environment, and I do believe with continuing to look at our salaries, we increase our hiring and the quality of staff. Our goals for next year and continue this year are safety and security and our hiring and retention. Those are our highest ones. But also we have to look at our plans for replacing staff with retirements and things like that. So I thank you very much for your time, being able to listen to us present. All three of us would stand for any questions we have. I do know at 11 we go into community corrections, but I'll stand for any questions you may have when it comes to the detention facility and its operation.
Go ahead.
Under our instant command?
Good morning, Commissioners. Eve Kendall. We have bought various PPE items. We go through a lot of personal gowns. We've gone to a plastic lab coat to try and extend out what we're wearing for our officers when they're in the quarantine modules, because we quarantine every inmate that comes in, every inmate and juvenile that comes in for the first 14 days. And in those quarantine modules, we have a higher level of PPE required versus the inmates that have been here for a while that we like to call legacy inmates that have been here and have shown that they don't have anything. So we have bought more for that purposes. We bought things as far as a lot of hand sanitizer and stuff like that, thermometers, things like that, so that we can take temperatures of our staff. We question and take temperatures of our staff every day to make sure that they are showing no signs or symptoms of COVID. We've also bought things for the inmates as far as so that they can do more Zoom court and things like that. So we've bought more technical things, technology type things for to do video conferencing and that kind of thing. And then we've spent most of our money on the PPE for the inmates and for our staff.
And of course, you had to fix up a quarantine room. I suppose there was some added expense for doing that.
We had 2 quarantine rooms or negative airflow rooms. We have not increased that number. We've talked about it. Our doctor says that right now we're okay, but you know how that goes. Once you need it, it's too late, right? So we're looking at where we can do that, because there are some physical plans to consider as far as where you can put the airflow and so on and so forth. We've also increased our airflow throughout the hold that we are doing on a routine basis before COVID. Now we're actually exhausting more, so we're using more air filters and stuff like that also in our systems.
I know in this building, we've looked at UV light, our air handlers. Is that something that?
We've really not looked at the UV light thing. We're still waiting on, the technical
Are we doing that with our masks?
okay things. Okay. We're actually waiting for the scientific studies and everything to be, completed and so on and so forth, because we don't want to spend the money and then they say, well, that's really not as good as what we thought it was going to be. So we always try and be physically responsible of what we do. Eye masks, which is helping some of our costs, because they do that through the UV rays and everything. But we have not gone through and said, okay, we're going to make these cells or, this area to where you walk through and because then we have all kinds of people asking, well, what are you doing to me when I'm walking through this, So we are listening to the EOC and to Dr. Pizzino and others. And we're talking to other agencies throughout the nation, seeing what they're doing, what's worked and what's not worked. You learn a lot when you talk to people, especially like New York and stuff, that's already gone through some of the craziness that we haven't gone through yet. So we're always looking to see what best practice is, and we try and model after that. Because we don't want to reinvent the wheel, and we don't want to do things that aren't going to work either, so.
I noticed that the state had quite a problem, and
Yes.
it seems like we've avoided that, and that's,
Yeah, I think that we were more proactive. We started doing things under Brian's guidance of starting to quarantine people early when they first come in, taking temperatures and stuff of the inmates, and questioning them where they've been, who they've been in contact with. We do all that before they even come to into our facility now. And if we have cause for alarm, then all the bells and whistles start going off, and and we gown up and mask up and everything else. So we're very conscientious of who comes into our facility and what they are doing when they're in our facility.
Commissioner Cook.
Brian, I don't know if the other two commissioners are aware why we have a separate sheriff's office from Department of Corrections. There's a lot of counties that your Department of Corrections and your sheriff are combined. Even in Sedgwick County, it's one sheriff's office. But why we have two separate departments, because that's, again, in a lot of communities, that's how they address the staffing issues, is that they would move patrol officers over to the Department of Corrections. So can you kind of talk to us why we have that
Sure.
uniqueness here?
And I did highlight that at the very beginning a little bit, but you bring up some very good points. That the jail was here in the courthouse many, many years ago, and it was run by the sheriff's office. There was a lawsuit regarding, more than one lawsuit, regarding the unconstitutional conditions of the facility, treatment of inmates, and things like that. So, and Shawnee County lost that lawsuit. A part of that in the Community Corrections Act, that they put a Community Corrections Advisory Board together. And there was a Community Corrections Act of 1978, which I think was nationwide. I don't believe it was just state. But they started looking at corrections very hard. And the Community Corrections Advisory Board here, and looking at corrections, which corrections professionals in prisons, law enforcement, decided that the best practices and the needs for Shawnee County was to have a Department of Corrections separate from law enforcement. A lot of times, there was some mishandling of officers and this, I'm talking many years ago, so, and we get along with our sheriffs now. But if an officer did something wrong, they said, okay, you can go work at the jail tonight. They had different uniforms. They had different pay. And they were seen differently. But if you were penalized, you went back to the jail, number one. Number two, there's a distinct problem in philosophies. Number one, they arrest, they apprehend, we're for the custody of care. Not saying we're not for safety and security, but we are. But we've had law enforcement officers that work at intermittent. When they come to the jail, they don't last because they're dealing with the inmates they had to arrest. That becomes a huge nightmare in the Department of Corrections. So we have to be very careful of who that. We had retired MPs and stuff like that have worked very hard. Yes, we have. But there's a distinct philosophy difference. And I will tell you, counties like Johnson County and some of the others, even though they have it under one facility, they treat their Department of Corrections, they pay them the same, but they treat them very differently. And Johnson County is even meddled with the idea of what we've done here in Shawnee County. They talked about it as far as meaning we should separate the jail and make it very separate and give them lower pay than the law enforcement. I said, do not do that. You keep your officers at the same rate of pay, but you separate it. Sedgwick County, those who are designated, they're doing basically pass and stuff like that. But we do have a fundamental philosophy. In going back since I've been at the Department of Correction, there's only been one sheriff that's had any interest in the jail. The jail, in talking with Sheriff Hill, who I'm very good friends with, Barta, Herman Jones, everybody, every once in a while this will come up, is about, the jail like this. They would be the first one to say, Brian, you're saying, we're not interested in the jail. You let the corrections professionals handle the jail. I do believe it works right. I do believe it works good. We We have a very good relationship when it comes to transparency. When we have investigations, we bring our sheriff's office in, we bring those people in. But it was our, I don't want to say founding fathers, but this has been the philosophy in Shawnee County, and we do get a lot of praise and a lot of recognition for the things that we have done as far as keeping them separate. They admire our working relationship, but having the identity. Yes.
So Brian, one of the issues that we always have at the jail is staffing. I mean, that's where we are always, since the minute I got here, there was the comment, if we just had an increase in our salary, staffing issues would be done.
Mhm.
We increase the salary, and then the state increases their salary. Things, it's just a constant evolving target, constant moving target that we can't ever seem to get over the threshold. And so, is there a reason why we can't take deputies and pay them as a part-time as a part-time helper to work at the jail? Why wouldn't that work?
We have intermittent employees. We don't allow probation, and we haven't allowed law enforcement to come in for the reasons I stated earlier. When you have law enforcement that arrests somebody, and then they come in and they're in the same module, they have to testify against them, or they're in the jail and they have to testify, it becomes the integrity of the court case, everything goes, it just simply doesn't work very well. Very, very few times do you see an officer working the road and then they come in and work in the jail because of their philosophy. We've hired retired police officers, and again, they didn't last very long. It was just the philosophy and the working environment of them working in a module around 48 inmates. It was like I didn't realize it was, in before, and I mean this with the utmost respect, in law enforcement, they drop them off at the jail. There is a little bit of time they can get decompress a little bit. I know they're going from call to call. With us, you get cussed out, you fight, you're still in the module with them. So we're always looking. We have people from the fire department. We've had people from other jurisdictions, like Jackson County, that currently right now are working and doing stuff at the Department of Corrections and working in intermittent. So we are exploring the intermittent and doing that. Right, corrections, first of all, if I talk to the Secretary of Corrections, or I talk to anybody, colleagues in Wyandotte County, first of all, corrections is just a tough gig. When it's just a tough environment, it is very stressful and things like that, number one. Number two, it's a buyer's market. People are quitting, looking for the next big thing. I can give you all I have an article sitting on my desk, and the HR expert says it pays to quit, and people are quitting. Right now, we've had people quit the jail, and with the CARES Act and stuff like that, they're getting $600 more on top of their unemployment. And so the union is upset because we have people that have left. They're getting paid more than here, so we have that happening. The quality of staff, we're getting people that simply can't make it. I firmly believe that when you see a sign at Hobby Lobby that says, we'll start you out at $15.75, or you can work at the jail for $15.75, that's a no-brainer. You're right, we do talk about raises and stuff like that. We can't just be like in gas wars, they raise, we can raise, we have to find a spot somewhere. I can tell you where we're at right now, we seem to always be at least $2 to $3 more an hour less than our competitors. With being the third largest jail in within Shawnee County. And we'll talk about it with ISP and having a caseload is just as big as the bigger counties.
But
It's
Brian,
tough to compete.
The downside, or I guess it's not the true picture, while we may be $2 or $3 behind the competitors, our benefits are oftentimes far more generous than the competitors. And we've had people that have left Department of Corrections thinking they were making more, but when they took into account all of the cost of health insurance or cost of amenities,
Correct.
they wound up making less. And again, it's not always an apples to apples.
It isn't. Where we run into with the Department of Corrections, because of statutory, they're under the corrections capers, and we're not. Jails aren't included as prisons. So a lot of people will leave for the increased pay and the increased retirement.
But they had the option of doing KPNF, 2 years ago?
Who's that?
No, we have not been given that.
No, we have
option.
not been given,
The
for
legislate-
us,
Okay.
The
the,
legislation has
the
not
j-
gone through.
prison systems right now are under corrections capers, which is not KP&F. Right now, they're trying to decide if corrections can fit under KP&F. And that is a voluntary issue for the county. And the way I understood it, and I'm not an attorney or anything like that, but the way I understood it is unlike the sheriff's office, and Betty can attest to this, they went back and paid all that back in the past. Let's say that the commission decided, okay, we want to do KP&F. It would be you start from this point on and you go forward. You do not go back and pay them up. That would cost the counties, I mean, just us alone would cost so much money and stuff like that. But there is those options. I will tell you that other jurisdictions, like Sedgwick County and Johnson County, and not Johnson County, Douglas County, were paying their officers in the jail the KP&F they got caught. And they had to refund all of that money back. And they said, because I tried to look, getting us into the corrections capers, at that time, capers said you have to have a certain percentage or participation from the state of Kansas. The other jails were the largest jail with outside of a KP&F. So it would have, about 4, 5, 6, 7 years ago, it would have been about $1 million just to get us into the corrections capers.
The last question I have, I mean, I agree that the roof is in need of some repair. I've noticed it several times, especially when you're over on the juvenile side and you can kind of see out over the tarmac and see just kind
Yes.
of what you're looking at, the standing water. I agree that that's probably an issue. My question is, when you're looking at renovations to potentially the juvenile area, after the Senate bill was passed and we just watched our juvenile population really shrink rapidly. I mean, we have just a small fraction of the juveniles that we used to have. Have we considered maybe going back to a separate juvenile facility, similar to what we had when they were over off of California, and then making our juvenile facility into our mental health facility? Because that's, I mean, we've always looked at our next need was for a comprehensive mental health corrections facility. But if
Well-
you had your mental health where the juvenile is at now, that's still in the same complex.
Yeah. Sold. Meaning, would love to, I think Shawnee County at the very beginning built a 75-bed facility because of the way the laws and things said at that point, and our jail was full. With the Senate bill that came back, and we're down to we're running an average population of about 25. I do believe, in my personal opinion, professional opinion, that Shawnee County should do a review of the juvenile detention center and look at building or buying some kind of facility that didn't have more than 30 or 40 beds, but also had secured facility for juveniles, runaways, keep the sinks and things like that away, much like other communities are doing. And then using that. With our female population, I at one time even thought about looking at trying to make that the female part. So we didn't even have any females on but the whole thing be a juvenile or adult facility. We have also discussed that being looking at a mental health. That would be a great idea. I would think that to look at the standards for KDHE, ACA, and juveniles accreditations, I don't know that, and Tim might know better than I or Eve, I don't know that we could find a place that could meet that. I don't know. I love the idea, and with the issues that I've seen communities doing around human trafficking and the children in need of care and things like that, they are looking. Wyandotte County, I mean, I believe they have just as many or fewer juveniles than we do. They're building a new juvenile detention center for this reason. It's smaller, and it's also to secure care people for human trafficking and those people that they can come in, get secure, and things like that for treatment. I mean, Tim, do you have any?
I'm sorry to
Love that
cut.
idea.
Commissioners, Tim Phelps, Department of Corrections. And one thing that I think I would add, because I think that we're speaking somewhat theoretically here, but there's a movement coming, and it will probably have some impact on the way we talk about this issue. And I know from, because we have the Juvenile Corrections Advisory Board, and as part of our work there, we are going to be a pilot site for a program called Crossover Youth. and that deals with the kids who were kind of put into a void because of the effects of Senate Bill 367, that now they score too high to go to sync foster care. They score too low, and therefore statutorily they can't go to detention. And so they're doing things like having them sleep in the KVC offices, and there's been some uproar over those kinds of things. There's a void, and when Senate Bill 367 first passed, different commission makeup at that point, but I think Director Cole, I don't remember who all were on the board at that point, Director Cole made a pitch about the idea that tried to get ahead of it, build a separate juvenile facility that includes child in need of care, emergency service operations, and so that we could be ready for that effect of 367. Well, time has passed, the effects here, now everybody's trying to run to catch up to figure out how communities that are dealing with that population are going to be able to meet it. So it is a very serious thing that is only going to grow in scope as this crossover youth program kicks into gear. So good, just information for you to consider.
Commissioner,
Yes.
I would like to make one other comment. This is going back to the salaries that we have talked about, that we have to look at that because competitors have increased their salaries. But one of the things, another part of that we've got to look at, and it's harder to look at and know what to do, our salary scale has a progression, an even progression up through the years, through the steps. Some of our competitors have not done that. They've thrown more money at the front end to get employees in, but then, so you're not really comparing apples to apples when you look at the scales, because they may be able to get those people in initially because they are paying more initially, but their scale is not as even upward trend
Oh, yeah.
as ours is. So
Very good point.
it's hard to, there again, it's kind of hard to know how to
Correct.
address that and how to approach it.
Any other questions?